as you may know, that junior doctors and other doctors in the BMA are also looking for an improved pay deal from this government. It's a real great shame that Therese Coffey hasn't taken the opportunity this morning to emphasise the value of medical and nursing staff to the health service and chosen to talk to us. We have written to Therese Coffey asking for some discussions about pay, and we haven't had any responses. So it's unfortunate to hear that, but we are still open to talks, and we wish the RCN all solidarity.
Okay, do you feel that junior doctors might also find themselves in a position where they have no alternative but to consider strike action?
Unfortunately, yes, that's the case. So the Junior Doctors Committee of the BMA have already said that if demands for increased pay aren't met, that there will be a ballot in January. So we're already on our way there for both doctors and, of course, for nurses.
Okay, talk to me about the report that you have done with the Doctors Association. What were you hoping to achieve from that?
So we've had a number of members come to us, a number of doctors come to us, predominantly from Nigeria, but also from other African countries, who have been recruited by NES, Cape Medical, and a number of other agencies and employers, and put to work either in the NHS or in private providers, and treated really appallingly. And they've expected to be treated properly as if they were British workers, as under the standards that we have here. But unfortunately, our survey shows exploitation, lack of support, threats, particularly to visa status, poor welfare and low pay. And unsafe hours, lack of rest, working above competency or without support are really threatening patient safety in those environments. So we are looking for significant changes to their conditions, including trade union recognition to apply to all agency medical staff, and for their contracts to improve up to the standards of the NHS, regardless of who the direct employer is.
Some of the figures that are in the report are really shocking, aren't they? 34% of those surveyed reported bullying and harassment, 47% reporting unfair treatment, and 89% report working over a 70-hour week, not only damaging for the health of those that are doing those, but potentially for those that they're caring for.
Absolutely. It's frankly unsafe, the conditions that people are working in. And I think that many, particularly those who are paying for their healthcare in the private sector, would be shocked and surprised by the conditions under which their medical team are working. There are plenty of doctors under this survey who told us that they were working a whole week on 168 hours with minimal rest breaks during the night, which might be disturbed. And so 70 hours was really almost at the low end for many of these people. And the bullying is, quite horrific. I won't repeat some of the racist things that people have reported to us, but I was surprised that they would come to such harassment in the UK.
So who's bullying whom?
So it's a mixture. So the doctors who are working for these companies are often from Nigeria or other similar nations, and they're facing bullying both from their employer, the agency, but also from their colleagues who are working alongside them in the health system. And it's quite difficult to challenge that, because if they challenge that, the agency or their employer is both their employer, their GMC responsible officer, their visa status holder, sometimes their landlord. So raising concerns often leaves you in a position of being very trapped. And it's quite difficult for people to get out of those situations.
One wonders who those people can turn to.
Absolutely. And we're encouraging those people to turn to us as their trade union. We're here to help. We have a contract checking service. We're trying to eliminate really duplicitous contracts that don't stand up to a moment's scrutiny. We're offering to support to international medical graduates who are new to the country. We're lobbying their employers for improvements to pay and conditions. And we're hoping that we can tackle some of the problems with them at work for a range of these organisations, which really shouldn't be allowed to get away with this any longer.